Again, a pleasure to everybody here today. And August 18th, 2023. We're in revolutionary times. I don't think anybody can doubt that. But what that means is that the situation is very fluid and we have great opportunities. And while we're centered on healthcare justice for all, we also need to recognize the intersection of other justice issues in terms of building our power and developing our strategy. And anybody who ever wants to have a conversation about strategy will continue to do so. Always love the input because it's critically important, as Mike said, that we build the relationships first. We have a visioning of what the future we want, keep that vision at the center of our thoughts, and then reverse engineer and think about how did we get there? How did we achieve this justice for all society? Through communications, through relationship building, through self-awareness, other awareness, defining our terms, building resources, planning campaigns for short-term, mid-term, and long-term successes. So that's the direction One Pair of States goes. And we are also multi-track. We work in support of the National Medicare for All bill. We're fighting privatization of Medicare. We're fighting to get the super waiver legislation that I mentioned at the top from Representative Ro Khanna. And we're working at supporting the states to collaborate. And that's where we're going to pivot first here today, is to talk about what we did in July, mid-July, July 14th and 15th, the reception the night before, and then the day of July 15th, between activists and representatives. If folks could self-mute, Mike, or you might want to mute everybody and then ask them to unmute. So why don't we just open up this conversation to folks who participated in that meeting. I'll just say, by way of sort of setting the stage, that I've spent the better part of 4 months, the end of last year and the early part of this year, 2023, 22, 23, meeting with most of the principals in Oregon and then in Washington, the folks that we work with from a distance. Through computers, virtually. I wanted to have a chance to sit down and break bread and have those important face-to-face relationship building conversations, tell stories, laugh, enjoy each other, break bread, and so forth. And I was determined, when I first went out there, I was thinking maybe I should resettle in the Northwest, since this is the cutting edge of where single payer is the best chance of being established, similar to the way that Canada started with Saskatchewan. But after talking to folks in Oregon and Washington, it became evident to me that I really need to make the trek to DC, where there's never been an established single payer presence lobbying on any of the issues that we've mentioned. And so that's where I'm pointed personally over the next couple of weeks. I think I found housing, so that's good. And I'm also going to put in a pitch here for fundraising. The skill set that I have would command or demand in excess of $100,000 a year, but I'm volunteering my labor. All I'm asking folks to do is to make small contributions, monthly contributions, simply to cover our costs, because we're going to need materials, and I travel quite a bit. And that's really what it is that you'll be supporting as you contribute to One Pair of States. We're also bringing Simon into the fold to work on the social media front and outreach to younger people, as well as to other justice communities. And we need to support that work. So we need to raise in the neighborhood of about $10,000 to $15,000 a year, which is not a lot, as you all know, for nonprofit organizations. We don't want to become another organization that's heavy laden with staff. We're really a virtually all volunteer organization, but we do have expenses. So please consider making a monthly contribution, $5, $10, 25, whatever you can handle. It's going to go a long way. We're on the cusp of something amazing, and that's what we need to focus on, and that's what I'm focused on. So thank you for that. And so the back part was, when I left the Northwest and came back to Pittsburgh, I said, let's put together a follow-up. Let's put together a meeting and put everybody together. And we did that. And we had our meeting in Seattle, and it was also a hybrid meeting. Mike brought in some great new technology. Mike, it's called the OWL, right? The OWL, which is a mechanism that has a camera that tracks the person who's talking in the room, and it picks up the voices around the room. And it was a far cry better than the hybrid meeting we tried in Denver the year before. So this can be done. Hybrid technology is growing, so we can bring people into these meetings more effectively. So why don't I just ask folks to come up and just make some comments on what your takeaways were from the Oregon-Washington meeting and plan steps forward. And let me start. Is Ronnie with us? Ronnie Shore. Is Ronnie with us? Mike?
Yes,
Ronnie?
he is. Yes, he is.
So Ronnie, why don't you,
Head.
okay, I can't see you on screen because you can take me off of Spotlight, Mike.
Okay.
I didn't shave this morning, so I don't want to.
Okay.
Yeah, let's start with Ronnie, and then we'll go over to an Oregonian, and then back and forth until we exhaust all the folks here in the room. And try to keep your comments brief, I would say, to a couple minutes, and then we'll pivot and talk about Sabuca and what it is that we're planning to do there, and then bring up Simon to talk about Discord, and then I think that's it. That's our agenda for the day. Thank you so much, Ronnie.
So thanks, Chuck, and to everyone who really helped make this event happen. We did pull together a great group of advocates from Oregon and Washington, and just building relationships between ourselves helped us focus, or helped me focus on the idea of building relationships with legislators, with other groups in the community. It was a very useful exercise. And people from one-payer states, we really owe you a tip of the hat, a true appreciation. And we identified several issues that we wanted to work on. I have not been involved in the preparation for this, so Chuck and Mike, why don't we go to the Oregon and Washington people that have been working this week to come up or to define the specific issues to share. So thanks.
Sure, and thank you, Ronnie, really grateful. And folks can just throw up your hands. I know we've got Linda Kruggier in the room. Of course, we have Mike. We have Charlie. Sam, you need to cut out soon, don't you, Sam? Sam, why don't you come up next, if that's okay?
Thank you. I actually was pretty impressed with the social aspects of the Seattle meeting, getting to meet everyone in person, not just to meet them, but to learn what their particular fields of interest and expertise were. And I'll turn the mic over to the next person because I'm interested in other people's feedback.
Okay. Should we stay with Oregon? Why don't we go to Linda? Linda?
Hi, thanks. Yeah, I was really impressed too with how the meeting was organized and how it moved along. For me personally, the visioning exercises I think were really helpful in taking a look at what do we think it should, what do we want things to look like, and how did we get there? Once we looked at that, as was already mentioned, the connections that we made with people and what their areas of expertise were, I think were really helpful for me. And then maybe most of all was learning. We heard a lot of really important lessons from each other, I think, about what works, what doesn't, what we struggled with, what we might do differently in the future. And from the standpoint of making progress, I think that's the way we're going to move these things forward.
Terrific. Thanks so much, Linda. And why don't we bounce it over to Maureen? Mo, do you want to weigh?
Yeah, I second what's been said already, and also wanted to say a couple of things. I really felt like it was a great way to bring together people from both states, a regional effort, and to talk about the things that we have to work on nationally, like Sabuca and the Medicare issues, and in addition to our own efforts at getting universal health care in our states. I appreciated the opportunity to be able to speak about, our successes and our frustrations with the commission here in Washington, and to get input and meet people from Oregon face to face who I had only met on Zoom or through emails and whatnot. So I think I want to encourage us to do this more. And I would have, a couple of things that I would have maybe done differently have to do with the technical or the physical setup of the meeting. And I'd be happy to talk to the organizers about that, not use our time today. But primarily I'm thinking small groups, so that we could have in a group of, 4 to 10 people. So really get more closely related, because there was some physical distances that were present in the way it was set up. But these meetings are really hard to put together, especially now that they're just the newest thing. But I'm encouraged by today's meeting too, that we're getting together and talking about this. So thank you.
And thanks to Maureen for monitoring your healthcare commission in Washington State. Let's see, why don't we bring up David? I'm going to bring you up last, okay, and then have you actually make some David Loud make some back end commentary about where we are on deprivatization campaign on Medicare. But let's bring up Charlie and then Mike and then Simon. Charlie?
So I guess I would echo a lot of what's been said. The best part was, the main reason that we're getting together personally, and that is building relationships. And so I thought that was a very useful thing. And I also appreciated, I actually stayed with Marcia Stedman in her house, and that I think also helped. It was nice to be able to spend a little bit more time and not just at the meeting with a Washington person. So I appreciated that as well. And I mean, it was also nice. Oregon's been going through some changes in, I would say, the leadership of the single payer efforts here. And so I actually had not talked much with some of a couple of the Oregon people, so it was actually nice to have that happen too, and have them be joining it. They actually just joined by Zoom, so it wasn't quite as useful as it might have been if they were there in person. But and I guess that's it.
Thank you so much, Charlie. And I know Catherine's with us as well. Catherine, I'll pull you in. Why don't you go now? Catherine, are you ready? Catherine Lewandowski? You might need
I'm on my phone, which is slow for me to find the buttons.
Okay. Just maybe a couple takeaways from the meeting. Yeah.
Oh, I thought it was well done. I was a little bit late because of traffic, so I almost wish that I would have done the virtual thing. So, but it was great for people to be able to get together and, like you said, break bread and have some really great discussions. So.
Terrific, Catherine. Yeah, and for folks who don't know, Catherine's our treasurer at One Pair States and also with another organization, Washington, Whole Washington. Thanks for your work, Catherine. Let's see, Mike, do you want to come up? Mike Huntington?
Yeah. Am I? Yeah, I'm not muted. Yeah, I was just elated by being with people, talking with them, in casual interaction at Ronnie's house on Friday night, and then during the meeting. And I agree with Mo on how we might use this OWL device a little better, even if it does handle a group of 30. But I think we need to bring speakers closer to the device, and we could still have a large meeting. But I do like the idea of smaller meetings as well. Anyway, I was very happy with the event, and really thank Ronnie for taking hold of it and making it happen. Oh, we're lucky.
Absolutely.
We're lucky we have Chuck too. On the way to the he and Claude Burfett were on their way to the Friday evening meeting, and they were in an awful accident, and we're lucky both of them are alive.
Yeah, I'm actually dealing with the fallout of that. I'll talk about that online still, but thanks, Mike, for that. Let's see, Simon, do you want to come up and maybe say even a couple words about Discord, and then David Loud will follow you?
Sure. I'd like to just say that I really enjoyed attending the event. It was pretty remarkable and humbling. I mean, like so many people that knew so much, being able to talk and listen to people who have been in this movement for a long time. And I found it very energizing, very fun to be there and get to participate. And it inspired me to want to build on this collaboration between states and different organizations. Further using my sort of digital outreach skill set. And to that end, I've been really trying to focus in on what kind of tools will allow us to continue the collaboration and continue the discussion in a really productive way. And as Chuck and Mike mentioned, I turned to a program called Discord, which I chose primarily also because it's used by a lot of young people. And we want to draw in young people to the movement. Essentially, I'm not going to go over it that much, but to briefly summarize, it's a platform that allows people to have discussion within a single sort of server, a single location, have discussions on a whole bunch of different topics, almost like a sort of message board, and you can do a video call just like you can in Zoom. And I'm trying to use a One Pair States server as a place to sort of be the center of that collaboration. I already joined and talked with the outreach group from Washington, and I think we're meeting on Discord at 11 a.m. today, coincidentally with this, right after this meeting, to try to test that out. So this is just a little bit of an example of the kind of discussions where you can have a back and forth talking about strategy and messaging and that sort of thing. And I'd love to bring in national organizations, state organizations to build the conversation. I will be probably organizing little tutorials, walkthroughs, that sort of thing, trying to build it up in the future. In the short term, I will drop a invite to the One Pair States Discord and some basic information on getting started on the platform in the chat. And I am excited those links are kind of all crammed together. I'll drop them in again separately, but I'm trying to use whatever I can to keep the discussion going. So that's what I'm up to at the moment. And
also, can you say a word about your podcast development?
Oh yeah, sure. And we're gonna make a podcast. I've constructed a little studio in one of the rooms of my house, so entirely taken it over with the objective of producing a podcast where I'd like to get on and talk to leaders of the single payer movement across the country, different people who have been in the movement for a long time and their perspectives, where they think we're going, what do they think we can do to achieve universal single payer healthcare, both to get people's ideas and different ideas and perspectives, and also just meet new people and hear from people that others may not have heard from before. So we're going to be doing that in the next few months as well. So you can expect that I'll be reaching out to all your different organizations and saying, please, will you speak with me? Yeah, so those are my two big projects, and I will drop those links separately, each one separately into the chat, so they're easier to discern and click on for the Discord.
Thanks so much, Simon. And really, you're inspiring all of us to take our game to a higher level. Really appreciate that. David, I see a question in the box. Bill, we are going to take questions afterward, and then we'll bring you up for that. Let's see, as soon as we finish with just the rollout of presentations. David Loud, you want to talk about your reflections on July 15th, collaboration, and then say a word or two about the Medicare for All, I'm sorry, the deprivatization of Medicare campaign going forward into the fall?
Sure. I thought it was very important that we were able to affirm and reaffirm that the state-based work is really part of an organizing strategy to get to national Medicare for All, our North Star, as we say. And I think that what we are just really learning and digesting is how serious an existential threat to the very possibility of a national Medicare for All plan the privatization of Medicare presents an existential threat. And I think that we need to recognize that we're not going to be able to get rid of the privatized Medicare plans, Medicare Advantage, ACO REACH, until we have the political strength to win Medicare for all at the national level. We're stuck with those private plans until we can win the big prize. And therefore, what my organization, Puget Sound Advocates for Retirement Action, has been helping to do in our state and with national allies is to develop an interim strategy to deal with that existential threat and that problem. And what we have settled on for now, we call level the playing field, level the Medicare playing field, meaning that folks in traditional Medicare should have all of the same benefits and affordability that people in the private plans have, thanks to the massive subsidies of the private plans by the Medicare Trust Fund. And specifically that we want to add to traditional Medicare hearing, vision, dental, an out-of-pocket cap, get rid of the 20% copay, and at the same time to go after the well-documented fraud and abuse and theft from the Medicare Trust Fund from the private plans, and to recoup the billions of dollars that are thrown away to the profiteers every year from the Medicare Trust Fund, to recoup a lot of that money for traditional Medicare, for the Medicare Trust Fund, to help finance the expansion of the benefits of Medicare. And this is something that is picking up steam. Our Washington State Labor Council, for example, just unanimously at its convention passed a strong resolution on this very point. And so I wanted to throw that in there, because in the bigger picture, you know, we can do all we are trying to do at the state level, but if we lose the opportunity for national Medicare for all, we're in deep trouble. So that's what I wanted to bring.
Thank you so much. And since we have one of the national leaders in that effort with us as well, not a scheduled speaker, but Kay Tillow, do you want to just take a minute or so just to add to or underscore what David just said? Kay Tillow, are you available? Unmute. Kay, are you with us?
Yeah.
What's the question?
Oh, what David just said. Do you have anything to add to the discussion of the work that we're doing to fight back on privatization of Medicare?
Well, you know, the most exciting thing is the grassroots movements that are rising up to end their being forced into Medicare Advantage. I think it's the first time we've seen any real organized on the ground efforts with a mass base, and we see that in New York and in Vermont and in Delaware, and the New York group is racking up some big victories. They just won another injunction, a permanent injunction against the mayor of New York putting the New York Public Service employee retirees into Medicare Advantage. But the good thing about it is that it's exposing Medicare Advantage for what it is.
Terrific. Yeah, thanks so much, Kay. And if you and David and others want to add any resource links into the chat, that's always helpful. I see Maureen put a link for an article from Nick Kristof. I think it's related. And we had a question box also from Bill Bronston, and it might be a question best taken up by a new addition to our meeting today, Tom Gottlieb, who has laid so much of the groundwork for the Oregon campaign. Tom, are you available? Just to, I don't know if Bill asked the question of what does the nurse organizing look like in Oregon and Washington? Tom, do you want to speak to that for a minute or so? Tom Gottlieb, if you're muted, unmute.
That's Colorado.
Yeah, in Colorado. I'm not sure I have information on that, Bill and Chuck.
That's my bad. I was thinking of Tom Sinsick. That I've just, my brain went, this is the fallout from the car accident. In all seriousness, I've got some neurological issues I've got to deal with. It's going to be a fight. Anyway,
The question was for all states.
does anybody want to speak though to the organizing nurses in Oregon and or Washington to answer Bill's question? Thanks for being with us in any case, Tom. What does
Chuck, the
nurse
question was
organizing
for
look
all
like?
states. The question was for all states, Colorado, Minnesota.
Oh,
The CNA and the NNU play such a crucial role for the last more than a decade
right.
in driving single payer legislation. I mean, they're the ones that are actually creating that legislation. And there's a struggle here. The CNA has been dissed in California, by various factions that are essentially, trying to
right.
kind of eliminate them, disappear them. That they've been removed from our website, for example, for PNHP, which is outrageous.
Right.
And I just want to make sure that people around the country are working with their nurses.
Right.
Really,
We do have a couple nurses with us here, active and retired. I mean, Lynn's with us, Caroline, Catherine. I know I'm missing others, but does anybody want to jump up and talk about nurse organizing? Specifically?
they need to be divided into OPS as an organization.
Yeah, absolutely. That's going to be one of my objectives when I get to DC is to connect with the national director of NNU. I'm sorry, the political director, Ken, I think his name is. I've got it in my date book here. But we are definitely going to be collaborating with the nurses, no question about it, on all fronts. I mean, continue to do so. We have been doing so. We'll build out on that.
Catherine has her hand up.
Okay, I didn't see that. Catherine, do you want to jump up? Maybe unmute.
Thank you. Sorry. Regarding the nurses here in Washington, it has been very difficult for us to get like our state nurses association, WSNA, on board with supporting at least our Senate bill and actually healthcare. They've been more focused on nurse protections and that kind of stuff. But I have to say that members of Washington and others, we pushed for a resolution at the WSNA convention a few months ago in May, and it was overwhelmingly passed to support Senate Bill 5335 and other forms of healthcare reform, single payer legislation. It was just awesome. And we also got a response back from Lynette Vers, who I can't remember if she's still president. I don't think so. She's past president of WSNA. And I'm supposed to be having a meeting with her. And also she's going to be meeting hopefully with Andre. But she was very impressed with our presentation and wants to sit down and discuss it with us. It was a really, really heartwarming email that we received from her. So that's what we're doing in Washington.
Thank you so much, Catherine. Mike, your hand is up.
Yeah, I think California Nurse Association is so powerful that it kind of frightens nurse associations in other states. And I'm pretty sure that's true for Oregon and maybe Washington. I don't know if that's a problem they can help solve or not, but that's one impression that I have.
Okay. All right, we'll make a dedicated meeting for this question, though. I think it's an important one. And then the nurses are a subcomponent of the labor strategy that we have going forward. And one of the first people I'm going to meet when I get over to DC is Mark Tutzik, our good friend who's up in Columbia, Maryland. And one of the topics actually that we're going to be talking about is the prospect, this is a big question, of a general strike. Los Angeles may well be on the cusp of a general strike if you're following what's going on there. It's not just the writers and the actors, but it's also the hospitality workers. Unite Here. Teachers are threatening to strike in Los Angeles. There's a really, really powerful movement that's building in the streets in LA. And keep an eye out for that for sure. But do any folks have any other questions of our presenters today? Anything you want to tease out for a few minutes, and then I'll pivot over to Sabuka. Okay, seeing let's Okay, we'll just run down what it is that we're doing with Sabuka and the rollout. This is again the state-based universal healthcare legislation. I put a link in the chat here for folks to donate for the work that we're doing to support myself and Simon in particular, but also our work group efforts, which are really our communications work. The research we've done over there has been very helpful and instrumental to any number of organizations. So please do support the work that we're doing. As I mentioned to you, moving over to DC, it's not just about lobbying, but it's about organizing. It's about building relationships with other organizations. It's also about sharing our vision, our strategy for how we're going to build the political power to win. We're not large enough yet. We're not big enough yet to prevail. As David Loud said, we've got to be very intentional in how we think this through and how we work to build a winning strategy. I've talked about this any number of times before, but it's something that we have to just keep drilling down on. And I know that the folks in Colorado, Jeannie Nicholson, a former state senator, has taken a cue, and she's building, along with Lydia and other folks in Colorado, a strategy that's going to allow that state to get over the finish line and model for other states. So strategy is critically important. Simon and I are working on a brochure, a two-sided brochure that people can use in local districts, as well as in support of the work that we do on Capitol Hill, a brochure that lays out the arguments, why Sabuka, why State-Based Universal Healthcare Act, why the super waivers, why it's important to understand that it speaks to the history of America and how we've gotten social, political, and economic reform moving forward. Also, Simon is working on revitalizing our website, in addition to the podcast he mentioned, in addition to the work he's doing on Discord. We're working very closely with our partners on Capitol Hill, developing a really good relationship with Rachel Madley, who some of you know is Pramila Jayapal's Healthcare LA. They're all in. Pramila is going to be the first co-sponsor of this bill when it rolls out. So what we'll do is Ro Khanna will be dropping what's called the Dear Colleague co-sponsorship memo right after Labor Day. And that'll circulate quietly, mostly among CPC members, Congressional Progressive Caucus members, but other members as well. And we want to get as many of those to sign on as possible before the bill is formally introduced in the 3rd or 4th week in September. And so what we need folks here to do is to keep an eye out, to stay alert. And we're putting together a one-click politics campaign, which is one level of campaign that we do to give you talking points and to allow you to reach out with your members. Mike, do you have something on that? Yeah, why don't we just show that real quick? This is one-click politics campaign.
Okay, this is a program that we have been using to reach the constituents of the legislators that we want to get to. So in the case of state-based universal health care, it would be all of Congress. And the message will be different for the House than it would be for the Senate. But this is basically what constituents would receive if they click on the URL that we would distribute. We had Walter Cronkite on here, who we all love, who remember him, but many younger people wouldn't know who he was. But almost everybody knows Martin Luther King Jr. and his quote. And this is the actual quote: "Shocking and inhuman." I think what the more familiar one is inhumane, but Martin Luther King really said inhuman, which is more incisive. So this is the message people would see. Congress inhibits states from eliminating wasteful costs. Ro Khanna introducing the bill. Take action. Tell Congress not to stand in the way of states that want guaranteed health care for all by passing the Sabuka bill. And this will help states model and build momentum for the North Star, National Universal Healthcare System, just as Canada did in the 60s. So when the constituent sees this, they fill in their name and go to the next, and it pulls up there, in this case, 2 senators. For us, it's Merkley and Wyden. And this is the message that those legislators will see. please create, co-sponsor, and actively support a Senate companion bill for the Sabuca. Rural hospitals are closing, people losing their lives, bank accounts. And then you submit that and it goes to their offices. So we're planning to send this out today, unless people want me to edit it.
Yeah, Mike and I went over a few edits earlier. So we're on the way here. This is part of the quiet campaign.
Terrific.
Because the bill hasn't yet been introduced in the form of a dear colleague memo. That'll happen after Labor Day. But since members are back on recess, you may have an opportunity to see them at an event. You may have an opportunity to, pull aside one of their advanced people, one of their aides, and just and put a bug in their ear. So that's the value really of the August recess, which we're in the middle of right now.
Bob Mason has hand up.
Okay, Bob. Hey, Bob. Bob Mason from Massachusetts.
Yes, I was wondering, there's one-click politics, which I've used before, but I can't recall if it has this feature. Does it allow people to edit that message to add their own personal, experience, or just to make it more personal when they send it out?
Yes, they do. And thank you for reminding me about them, because I think we need to remind people that they can do that. And it's really better if they do, so that the robotic processors of these see this as individual letters rather than as the same text every time.
Great. I definitely endorse that. Thank you very much, Mike, for setting that up.
Okay, terrific. Thanks, Bob, for that catch. I also threw in, most people know this number, but I have it committed to memory since I was a personal aide to Alan Cranston back in 1982. And the phone numbers that Alan Cranston was a former senator from California, same phone number, 202-224-3121. I've got that buried in my brain, but that's the Capitol Hill switchboard. That for some people who you can do that as well. You can call directly your members, call them at the district office. I would just layer on your lobbying efforts. And I've lived in so many districts across the country. I'm going to identify with all those districts as I'm campaigning on Capitol Hill. Since Bob is with us, he's part of the Sabuca working group. We have several people who are part of a state-based universal healthcare group that's been meeting mostly weekly until things slowed down in the last few weeks or so. But we've been working diligently at collaborating with Representative O'Connor's office. Every other week, we bring in.
Did you come downstairs?
So Mike, we need to mute folks.
I'll take care of that.
Okay. We've had some discussions about the language. Just to give you a heads up, Ro Khanna is planning to insert new language, additional language, explicitly in support of reproductive rights and gender affirming care. Just to give you a heads up that is going to be part of the new language, the new iteration of the state-based universal health care bill. I talked to him about that because the group was not entirely unanimous in necessarily going in that direction, because of the effort to try to win over, let's say, moderate to corporate Democrats and maybe a handful of Republicans. Sam Metz, who was with us earlier, has been working with Warren George. I'm working on my former rep as a Republican, and that language could push them away potentially. I talked to Ro Khanna and he said, we're not in the majority. So for this session, for the session 2023-24, he's thinking of the legislation really as in part as a messaging bill. Messaging, and that this means that an explicit effort to reach out to these aggrieved communities, these communities under attack, women's rights and gender, and the queer community, LGBTQ communities, and particularly the trans community that are under attack. It's a way to signal to them that not only are we standing with them explicitly in defining their health care as a human right, as a fundamental right, but also from an organizing perspective, this is an opportunity for us to build stronger alliances and bridges with those communities who are not necessarily focused on healthcare justice as their primary objective. But here's an opportunity really to expand the discussion, to bring in those groups, saying that Representative Khanna is being very explicit. The other thing to say is that we're also in the process of recruiting a U.S. senator. We've been working at this for a couple months, and we'll continue to do it until we're finally successful. We have a number of U.S. senators that we've targeted, Tammy Baldwin from Wisconsin, Reverend Raphael Warnock from Georgia, and Gary Peters from Michigan, Cory Booker from New Jersey. And right now we're centered on potentially winning over Senator Markey from Massachusetts. So we're working right now at discussing this prospect with his staff. The thing about the Senate bill is that the language doesn't have to be exactly the same, but the basis of it is the same. So if Markey were to choose to not include that reproductive rights and gender affirming care, fine, let's just move forward. But the Senate's important because the Democrats are in the majority over there, and we have the prospect of having hearings and more elevation and education, as opposed to the House, where the GOP fascists are in charge and they're not going to allow such a hearing. So that's
What about Jeff Merkley?
Jeff Merkley I think we're going to take another run at Jeff Merkley, but he is very deferential to his senior partner in the Senate, right? Senator Wyden. And since Senator Wyden has taken the position, at least heretofore, that Section 1332 of the Affordable Care Act is sufficient in terms of waivers. We beg to differ, but we don't want to, Jeff Merkley needs to sort of navigate his own waters. And so far he's signaled to us that he doesn't want to necessarily go that direction in being so explicit. He may sign on with the bill, but in terms of taking a leadership role, it's not looking very likely, but we're going to just keep going around the horn until we finally find a senator to run a companion bill, which will elevate the effort. But thank you for the question.
Charlie has his hand up.
Hey, Charlie.
I was, Chuck said what I was going to say. I'll take my hand down.
Oh, I'm sorry, Charlie. I didn't mean to steal your thunder there. I don't see all that.
Oh. Yeah.
Here. And just have to say, Charlie's done, I mean, so many people here have done just an amazing job. I can't thank people enough for the work that you're doing. It really is amazing. We are on a cutting edge here of establishing something that could be a real breakthrough for, again, not just healthcare justice, but all justice. And again, to give a shout out to the folks who came on in the early part of the meeting, we encourage other folks outside of Oregon and Washington to consider doing the collaborative work across states. And we'll support you with that. We'll do whatever we can to make sure that you have the tools, the resources necessary to make that collaboration happen. I know Betty Keller's with us, other folks from New England. There are some preliminary conversations and discussions going along New England states, possibly collaborating, mid-Atlantic states. Some discussions are happening there as well. So this isn't just isolated to the Northwest. And in terms of California, we want to bring California, we want to bring Colorado, we want to bring Hawaii into the equation as well. We're just starting out right now with Oregon and Washington as this sort of a model for what collaborative state work can look like. David, did I steal your thunder? David Loud?
No, I just wanted to say that at a meeting of Healthcare for All Washington last week, one of our healthcare champions in the state legislature, Senator Kuderer, who's running for the insurance commissioner, by the way, reported that she has talked with legislators in California, Oregon, and Alaska regarding a multi-state pact. And that was news to me. I mean, we've talked for years about a blue wall on the West Coast, but I was glad to learn that Senator Kuderer has had some. We got to follow up on that. So just more on the same point.
That's promising. That's great, David. Thank you for that. Yeah, please buzz me maybe early next week or later today, and we can continue that conversation. Yeah, Bill Ronston. Yeah, of course. Well, more states the merrier. You mentioned Alaska, which David just mentioned, Nevada. We need to build a partner, a one-pair states presence in Alaska. We also have, just to mention that in Utah, one of our One Pair States folks is doing work there to build out support for a state-based campaign in Utah. So the work's happening all around the country. Absolutely. Again, encourage folks to please, support the work that we're doing. You'll get more, bang for your buck here, I think, arguably than most any place for the work that we do. If you can do a monthly contribution of any amount, 5, 10, 25 bucks, whatever you can handle, it's going to go a long, long way to keep this work going. And I don't intend to be alone in this work. I'm going to be recruiting people into this and replace myself ultimately. The fact that Simon is with us speaks to the need and the importance of having co-leaders, young co-leaders, as well as leaders. We need to cultivate new leadership going forward. This is all very important. All the things that we're doing are very, 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 very valuable and important. So thank you so much. Anything else, Mike?
No, just a comment on the owl. It costs $1,000, but if you buy all the equipment that you need for a good hybrid meeting, the cables, the microphones, the webcams, mixer boards, audio cards, you probably come close to that amount. Yeah, I think we can use the owl better, but it's quite an advance over what we had before.
Okay. Thanks for that, Mike. And I can't thank you enough for the work you do. Mike keeps my sanity. I cannot tell you how many times I call him a day just to say, Mike, can you believe it? He is just my rock solid work partner. And again, to Catherine, who keeps our books and money operation up and running. Thank you for that, for both of you. Our next scheduled meeting is Friday, September 15th.
David has his hand up.
Just note the next meeting, Friday, September 15th. And then we'll be reporting where we are. We'll be in the midst of the Sabuca campaign. David Loud. Hey, David.
Yes, I just wanted to add that one thing that the folks from Oregon brought to our Oregon-Washington meeting was healthcare for all, chants and songs. And I just want to say, one of the things that our movement has been lacking is sort of things that are specific to our cause. And so songs are a great way to start. And so Mike, I think that's something that you could share with everybody. And there's another song that came up out of Washington to the tune of the Erie Canal that I'll throw in the mix when you do that.
Okay, thanks.
Yep. And Mike did lead us in song, just to give him credit, in Seattle. So we're grateful for that. But David, yeah, really good, important point. I mean, movement building needs to be fun, and we need to really enjoy each other, and the relationship building is really very important. So thank you for all you do, David. Terrific. Thank you for the resource sharing. Thank you, everybody, for coming in today.